our CEO from Pakistan, who is actually a retired army person, but doesn't want to be called a retired army person, but wants to be called Saleem Azhar, what's his name, Azhar Saleem. And let me tell you, I asked him, why do you do this HDF work when you were in the army? And then he went to corporate sector and worked there for 8-9 years. He worked in the army 25 years. So I said, what made you decide to do this social work? I was lucky enough, one of those people who interviewed him for this job in Islamabad, myself, Shehnaz, and there was Dr. Sami Khan. Dr. Maqbool was also interviewing people, but he didn't do it because he knew Azhar from before. So Azhar told us that when he was in the army, he used to go to the border on exercises, and on the way he went through a lot of rural areas. And he saw, the first time it hit him was that he saw a lot of children playing. It was July, very hot, and they were going nange pair without any shoes on the hot sand. And he really felt so bad that why are we spending money on these exercises in the border? These children should be helped. That's where the whole thing started, and then it continued as he had more experiences. Then when he saw the HDF advertisement, he applied. And let me tell you one thing, that since Azhar has started 2003, 4 last years, I have yet to tell you, if I send him an email asking him for something, 12 hours later I get the answer and the work is done. I never have to say second time to Azhar what I have asked him to do, or anybody else. Everything is so perfectly done. The projects, when I go and see, everything is taken care of. He works from 9 a.m. to 11 p.m. And I have just asked him to please cut down your hours, because you can't keep going on forever like that. But he's an workaholic, he's dedicated, he's motivated, he's one of our best that I have seen yet. And I would invite Azhar Saleem to please come and present our project in Pakistan. Thank you.
Assalamu alaikum, ladies and gentlemen. I really feel privileged and honored being amongst you, the real force behind whatever we are doing in Pakistan. And I think that being here itself is an honor for me. Today, I'm not going to talk about any philosophy. All that I want to say and talk about is what we are doing there and how we are doing there. As we all know, that Pakistan is 6th most populous country in the world and 2nd populous country with Muslim majority. Having achieved nuclear capability, we claim ourselves to be champions of the Muslim world. But irony is that we are still in the shackles of poverty and deprivation. And I think, as has already been said, we today stand 134th amongst 175 countries which are members of the United Nations, as per the Human Development Index lately published by UNDP. I think it's, as Dr. Atiya said, all because of low literacy, health problems, and many other problems that are prevailing in Pakistan today. Now, who's going to do anything about it? I personally feel, and I think all of you will agree with me, that it is me and you and me. We can't leave everything to the government. It's us, we there and you here, who love Pakistan, and we really want to do something so that we come out of these shackles of poverty and deprivation. I would also like to admit here that this is the 3rd time that I have come to US, and the kind of feelings that I have seen every time here with people in United States, I really get inspired. And when I go back and talk to my people there, my staff there, I go and tell them that this is how people who are living outside Pakistan feel about Pakistan. And that inspires us to do a lot more. And we feel that it is us who have to do everything for this country. We can't just leave it for the government to do it. There are many other organizations doing similar work. There are many individuals. So each one of us, each one of the organizations that are involved in these kinds of developmental works have to do their bit. And I think we should do our bit, each one of us. I've been told to restrict my talk within 15 to 20 minutes. I'll try and do that. Just to recapitulate, this is our mission statement. I'm sure you are quite aware of it. And just before I proceed, a little flashback back for you to see the history of Human Development Foundation. HDF started in 1997, and then up till 2003, we have been starting our work there in Pakistan with effect from 1999 till 2003. We had gone into 7 regions, and then the 8th region came about when we did something in connection with the earthquake. So that's how we are today present in all the 4 provinces of Pakistan with 8 regions, which are Mardan, Shamsabad, which is a place close to Tanda Muhammad Khan, Rahim Yar Khan, Zob, Karachi, Chakshi, Abadi, Islamabad, rural area, Lahore, and last of all, Budna. We are working in the form of 23 units, and each unit comprises 1,000 households. And keeping in mind that there are about 8 people in each house, there are about 200,000 people who are our direct beneficiaries, and then there are another about 100,000 people who are our indirect beneficiaries. These are those beneficiaries who are benefiting through our partners. We are working through the interventions as flashed, and first amongst them is social mobilization, education, economic development, health, and community physical infrastructure. I'll very briefly talk about each one of them. And before I do that, I'll just tell you a little mechanics, the way how we do it. Well, we go to the communities, we have experts with us who are masters in social sciences. They go and create community organizations, and at the lowest level, we call them development organizations. They have members ranging from 10 to 20 people, and they represent 10 to 15 households. Then as we move upwards, so to say that in a village, there are 3, 4, 5 of such development organizations. Then at village level, we convert them, or we take out another community organization out of these, and we call them as village development organizations or VDOs. And then the supra organization on top of them is the UDO, the Unit Development Organization, which has 1,000 households. Now, out of these development organizations, we have committees formed, like parent-teacher associations, health committees, and things like that, which manage things at their own levels of the projects. Now, social mobilization, we call it as one of our interventions because this forms the basis of all interventions. All the work that we do is through the basis of the social mobilization on the basis of the social mobilization that we carry out there. And in that, it is all through participatory approach.